Alrighty, good morning, Pagosa. It's Friday, holiday week. Hope everyone had a great Thanksgiving, and here we are. Can you believe it? We're on the air here this morning at the hospital, Pagosa Springs Medical Center, and I'm happy to welcome or visit with Jodi Scarpa. You've been on the radio before. Hi, Jodi.
Several times.
Yep, you're the Foundation and Community Relations Manager.
Yes.
Also, Krista DeCola. Mm-hmm. The QAPI Manager. We're going to find out what that is.
How are you? Just a fancy acronym.
Hi, Crystal.
Hi, how are you?
Oh, good. You spoke with Christy the other day when we were live over here at the hospital.
Sure did.
So welcome back to the radio, you guys. And we're going to maybe some introductions just to get started. Who wants to? Jodi? Okay.
I'm Jodi Scarpa. I'm the Manager of Community Relations in the Foundation, and I'm excited today, Will, to tell you about what's going on in the Foundation for the holidays. We're going to have a wreath auction that is beginning on, I'm trying to look to see, November 29th. It will be in person here with bid sheets, a silent auction, and on Facebook, which will be an event page. And we have 35 wreaths beautifully decorated by the departments in our organization. And every year, they just wow the public, and we're excited this year. We're more open than we were last year, and we'll have the bidding sheets at the volunteer desk and buy the wreaths at the registration desk. I'm so grateful to work with wonderful people who are also so creative. I'm not creative at all. So I can't.
Yes, you are. I think
no,
you are.
But
you know how to throw parties. They're creative.
Thank you, Will. The second thing we're doing, we're excited to participate in the Festival of Trees at the Community Center. So every year, if you don't know about it, the Community Center has a fundraiser where they ask local nonprofits to enter trees into, and I think they have just 20 trees.
That sounds about right.
20 trees, and ask nonprofits to enter them. So the Dr. Mary Fisher Medical Foundation, that does business as the Pagosa Springs Medical Foundation, is entering a tree. And our tree this year, the theme is a Dr. Mary Fisher tree. And the Foundation's namesake is Dr. Mary Fisher, who was a doctor who roamed the mountains and took care of people in Pagosa Springs in the early 1900s. And urban legend has it that she had, in historical records actually, that she had a pet bear named Pickles and had a couple wolves and was paid in a variety of ways that not always included money. The community was blessed to have her for 62 years, and she died of breast cancer at that point. So this tree is themed Dr. Mary Fisher at the beginning of the century, and it will have Victorian ornaments. And under the tree, I am pleased to say that there's a little wagon under the tree that will include lodge cookware from Terry's Ace Hardware, 2 yearly passes from the Springs, not day passes, yearly passes.
Oh, wow.
A $100 gift certificate to the Alley House, a Pendleton blanket donated by Goodman's, and the tree is decorated by our Kathy Douglas, who is our former COO, CNO, and Liz Reese. And we have 2 tables there. And we're excited to see the public. And the public can come, and you don't have to have a table on that Friday night when it is Festival of Trees. The public is invited on that Thursday to come view the trees and vote. It's $1 a vote. And the top 10 trees with the most votes get cash prizes. So we're hoping for number 1, but we'll take whatever the voters give us. We're excited to do that.
Which Thursday is that?
That would be Thursday, November 30th.
It's the 30th. Okay.
And then Festival of Trees is on the 1st. Mm-hmm. And our wreath auction ends on December 11th at 1 o'clock.
Oh, yeah.
Other things that are going on we're in the works to prepare to renovate the medical wellness building that's on the corner of 160 and South Pagosa Boulevard. We're finding out very quickly that prices aren't what they were in 2019, and we have a lot of extra costs that we didn't count on there.
It's an older building or something.
It is. It is an older building.
Dr. Pruitt's office or somebody's office? Yeah.
Yep, it used to be the brown one on the corner.
Yeah.
So it's looking for an uplift, Will.
So, I get it.
And we were awarded a grant from DeCola to renovate that. So
it's always good to renovate something if you can, right?
Yes, with grant money,
especially.
Yes.
How many square feet do you know? It's
around 8,000, a little more than 8,000. It is large.
That's significant. Wow.
It is large. Other activities we've had lately, a lot of grant writing. We wrote a grant and were awarded it for a building to house oxygen generation equipment. Earlier than that, we were awarded a grant that we're really excited about. It's a training grant to hire a coordinator and create a grant to train not just our EMTs that our EMS department has been working on over the years, teaching classes in the community and at their training center to flesh that out, to train people to be medical assistants, CNAs. Is that right, Crystal? Yeah. Crystal's a medically trained
certified. No, wait, nurse.
Certified nurse assistant.
There you go.
Yeah, not a nurse.
You have a lot of acronyms. Don't you? Lots of acronyms in this business.
Right. She's on it. And we're looking forward to completing these projects in 2024. I know Rhonda's due on the radio soon, and she'll give us more details on that in the future.
Very good. We'll look forward to that. Thanks, Jodi. That's a good update.
Yes, and I'm excited to hand the mic over here to Crystal, who is new to our area, but not really. Did you vacation here before?
I did. We had come here 4 other years for the ski joring race that they used to put on in town.
Nice.
And after the first time, I fell in love with Pagosa, and every year I told my husband that we would be moving here. And finally this year is when we made it happen. So
very good.
So,
do you have horses? Or
No, we don't have horses. My husband is the skier. I don't do anything. I watch on the sidelines, and as a nurse, I provide Band-Aids for boo-boos and ibuprofen and others. But no, I don't do any of that. I'm a competitor's wife. I cheer very loudly.
That's cool. Well, let's hope we'll get some snow, and we'll get that going again this year.
Yeah, well, I think it's wait until 2025. It's been great. We've been here since May. And
and we're really excited to have her be our manager of quality. And that's not something that it's hard for people who don't work in a medical system to understand what that means. So I'm excited that Crystal can explain it.
Yeah,
QAPI, right?
Yeah.
So quality sounds like that's the Q.
That's the Q.
Yeah, like you said, we like acronyms in healthcare. So it's pronounced QAPI Manager, which is crazy, but it stands for Quality Assurance and Performance Improvement.
Wow.
So it's under a big umbrella of. We look at everything in the quality department from our the different types of goals that we set for a hospital, how we're providing care for patients, how we're performing on that care, how are we keeping patients safe, and how are we providing evidence-based care, meaning care that's been researched over the years nationwide, and how we're bringing that to Pagosa and making sure that we're treating our patients, excuse me, with the best possible care plans that we can. Mm-hmm. So, There's a few different pieces of quality. One of the things I wanted to touch on today was actually called something. It's called the Hospital Transformation Program, and it's an incredible program that not something that only Pagosa Springs Medical Center does. All around the state, they do this. It is in partnership with Colorado Medicaid.
Okay.
And it really is an opportunity for us to look at how we provide care to our patients in a cost-effective manner, but still being able to deliver on that high-quality care that I think everybody comes to the hospital to receive. And so this program is something that started, we are in our third year. We just started our third year in October, and it builds on itself each year, which is really cool. You build into your foundation. But it really looks at things like care coordination. And what I mean by that is how we set our system up to provide our patients with care when they're in the hospital, and also after they leave the hospital, are we making sure we're setting them up for success so they can heal properly, that they have the right resources if they need something. One of the examples of that, we have a nurse care manager who actually calls all of our patients after they're discharged from the emergency department to see how they're doing, to help them schedule a follow-up appointment. That is really important. Oftentimes people leave the emergency department and their hopes of healing, but sometimes things go wrong or they're just not feeling better. This allows us to intervene early with these patients to make sure we can get them in and seen if something's not going right. So that's one of our initiatives there that we've been working really hard, and we've had a lot of success with that. The other thing that is really important, a lot of our patients, sometimes they're seen in the clinic and sometimes they're seen, their primary care providers are outside of Pagosa Medical Center. And so we've worked really hard to build a program with our technology to send a summary of care, just what happened in the hospital, what happened while you were here, and we send that to their provider who takes care of them on a regular basis. So there's no gaps in care. And so your provider knows exactly what happened when you were in the hospital. So I think those are two really cool initiatives. Another one that we've been working on with our nursing care managers are how we treat patients who've got lifelong illnesses or diseases, and how we make sure that they're not falling through the gaps. And so a lot of these folks who have congestive heart failure or COPD or diabetes, we assign them a care manager, and they walk hand in hand with these patients throughout the years to make sure they're getting the checks they need, that all of these things are under control. So these are all just different examples of some of the things that we're bringing to the community here, and I think I'm very excited about them. I work with a quality coordinator, Peg, who is phenomenal, and she's really keyed into wellness and prevention for these patients. And I think that we're excited to what we can bring, and I think it's really going to impact our community.
So that's fascinating. Yeah. So Hospital Transformation Program. I just figured that one out. HTP.
HTP. Yeah, I'm sorry.
No,
See, again,
you said
acronyms.
That. I know, acronyms. And this hospital's been transforming for a while, and it's just fabulous how it's transformed.
Yeah.
So,
well, we have a
job.
lot of support from the leadership to be involved and really figure out what works in today's day and age. There's a lot of different components with technology and how we reach our patients on the phone, email, text messaging. Sure. What do they prefer? One of the most important things and the important questions we can ask is what the patient's preference is. Mm-hmm. I think historically in healthcare, we have gotten into a place where we as clinicians are going through some of the motions, and we forget to pause and say, what is your preference on XYZ, whatever it is. And so a lot of these initiatives or things that we're doing really take that time to pause and ask them and get them involved in their care. Because we're all different, This is not like we're not cars. It's not easy. A mechanic can go in and know how to fix a carburetor. Well, we don't work that way. We're humans.
We're all learning how to embrace the technology as it changes and so quickly.
Yeah.
But for example, I like getting a text and a reminder. You're supposed to be here at this time, or what? That kind of thing. Some people may not, but things like that. And then the prescriptions at the drugstore or whatever. They call you up, or they send you a text, and I don't know.
Yeah, we have some really cool projects coming. They're a little bit longer, but to really improve our patient portal, to be a little bit more user
on the
friendly.
website,
that is something that you can log into as a patient.
Schedule maybe
and
an
you
appointment.
can schedule appointments. You can get text reminders of things. Not yet. This is a big initiative or thing we're working on. It will go through 2024, but we've actually started working on it a couple months ago, and so these projects are big. They take a long time to build the right framework, but I think that for what they will offer our patients is very nice. Healthcare can be confusing. Navigating it can be confusing, and we don't want that to turn patients off and not come because of it.
Right.
We want to make sure that we're accessible, that our door is open, that they can get the right care at the right time. And so that those are all different pieces of things that I do in the quality and performance improvement project. I'm also a nurse, and so I get excited about this kind of thing, and I kind of nerd out on data and stuff like that. So I have a lot of passion for it, and I think Pagosa is a great community. I came from Denver, and I loved being in Denver, and I loved my old hospital. It's different here because you truly are seeing the people in your community that you're helping, and it really drives people. And I've noticed that here at Pagosa Medical Center. People are really here, and they're driven to help the people in which, they live in the community. So it's been great.
That's one of the things I love about working here is that so many of us are mission driven, and it's really something I'm thankful for this Thanksgiving week that I get to work with such great people.
You do. You have some great people here. Great team. And that's fascinating to learn about QAPI management. I had no idea.
Crystal's involved with other things, too. The Zero Suicide program and a workplace violence program.
Yeah.
Unfortunately.
Yep. Those are two really big projects that... They're very complex and they're very dynamic, but I'm really excited that our leadership has put so much effort and focus on this. This is something that, the Zero Suicide Initiative, which is a nationwide initiative, really allows us to transform and just do things differently. And it removes the barrier, the uncomfortableness about talking about these things. One of the things that you'll be on the receiving end of if you come and seek care anywhere in our clinic or our hospital is a depression screening.
Yes.
And so that is the first step to helping identify these things and talking about them. And we've worked with our community partners to set up resources for people who are having signs of depression, even if they're mild. That's okay. We want to align them with the right people to get the help they need. Early intervention is so important with those sort of things for depression, and nationwide. There's such a focus on substance abuse and opioid abuse, and we have programs to help support those patients here that that are fairly new to the community, and there's been a lot of engagement from providers in the community just to how do we align our services to make sure nobody falls through the cracks. Right. And then, Jodi also talked about, workplace violence. And sadly, workplace violence is and has been the last few years on the rise in healthcare. And so we talk a lot about that. We have a very, engaged group here. It's not hard to get these initiatives off the floor because people here care. And so a lot of work around those sort of things. It's been fun.
Fantastic. Okay, well, why don't we take a quick break? We're here at the hospital today, and it's Good Morning Pagosa, and I want you guys to hang in there. We'll be right back after these messages, and we'll be back with Jodi and Crystal in just a couple of minutes. All right, we're back. Good Morning Pagosa continues. And Jodi Scarpa is here. We're at the hospital. Actually, I'm here. Jodi and Crystal DeCola, we're live on the radio this morning after a nice holiday. And it continues. But anyway, where did we leave off, or did we leave anything out? Would you want to cover anything else?
I just wanted to say happy Thanksgiving and kick off the holiday season with a shout out to everyone who works at PSMC and how grateful I am to work with each and every one of them. We have an amazing team.
Yeah.
How about you, Crystal? What are you grateful for?
Oh my gosh, the list is long. I'm very lucky and fortunate.
That's cool. We're lucky that you moved here and chose Pagosa.
Yeah.
And
Gosh, this is a great community, and it's gorgeous. The views, it's just so different than Denver. But I'm very thankful that I have found a home here. Everybody here has welcomed me with open arms, and it's just exciting to be in a place that, like Jodi said, the culture, the environment of caring and truly wanting to serve others and help, people live the best lives they can. It's very evident here. So I'm very thankful for that, and being a nurse and being able to work on high level initiatives, but also continue to be a nurse's nurse has been a blessing for me.
How about you, Will?
we're thankful for you guys. We're so grateful this hospital's here, and it's been really fun to watch it grow. And yeah, just amazing when you think 20 years ago it was like barely a clinic. And then here we are in this beautiful building, all these great people. Your team is amazing. So feel very lucky. Yeah. Thank you.
Yeah.
And I just want to remind people about the Wreath auction.
Yes.
And I forgot to say, you can like and share on Facebook. We're the Pagosa Springs Medical Center.
That's
Facebook.
Yeah, okay, on Facebook. Yeah, it seems like it was yesterday the last wreath auction was taking place. We were downstairs and all the wreaths were down there. And is it the same idea, right?
It is the same idea.
So people come over and look and choose, or
you can look
bid
online.
Online
too.
Our
way, we'll mail them out, and you can call me if you want to make a bid. I'll do it on email or phone. It's 970-731-3700, extension 3811.
And the deadline is the 11th.
Yes, at 1 o'clock.
Of December. Okay. 1 o'clock, 1 p.m.
1 o'clock. And registration and staff are always sad when the wreaths get taken over.
Yeah, they're festive.
They're stunning.
And creative.
You have to come by and see them.
I'll check it out.
Yes.
And then the Festival of Trees is next week. So get ready for that. Thursday
for the public viewing, and Friday night for the event where the auction is.
Perfect. Well,
come vote for it.
Yeah.
Thank you so much, you guys, for doing this on a holiday week. And, it's perfect timing. It's 8:30, so I think we got it covered. But
all right.
Are we good?
Yes.
I'm good. Thank you for your time.
We're all still friends and everything?
I would hope so.
Sounds good. Excellent. Okay.
Great.
Thanks, Crystal and
Thank
Jodi.
you.
We'll see y'all later. Have a great weekend.
You too.
Thanks.